This is chapter 4 for the medication orders and labeling for sterile compounding, and a little history on this chapter includes review of ancient times dealing with prescriptions and how they were written, herbal medications, the Greek and Roman influence on medications, prescription evolution, and the RX symbol and what signa means. So if you would please make sure that you've read the historical background in the yellow pages at the start of chapter 4, running from page 85 through 89. So let's talk first about the objectives. You can read through these. As I've said, the historical routes. Primarily this chapter, even though terminology and abbreviations as well as acronyms and symbols are a component, I'm just going to spend a little bit of time on that. You've covered most of that in Pharmacy Practice, Pharm 102. We will focus more on the physician instructions and how to read a label and the different parts of a label that are important for a compounded sterile preparation. So, just reviewing, common medical abbreviations indicate specific patient care facilities, units. So what does that mean? Departments. On the label, different than a prescription blank that you receive in a community setting, when you receive it, you have to have the patient's name and their address. So in a hospital, we don't have their address, their billing address, their mailing address on their information. What we do have is their location in the hospital. So their, so to speak, address in the hospital is what's identified. That would mean if they are in ICU, for example, that would be a location. ACT, which stands for Acute Care Telemetry, would be a location. Oncology, which is generally abbreviated ONC. Then further to that, kind of like that's their street or town that they live in, we would need to know their specific location. So their room number and their bed number if it's not a private room. So that information will identify that component. Also, information on their diagnosis, condition, any procedures, treatments, specific activities or directives, equipments, and tests would be listed on their medical orders. So when a patient's admitted, it would say what their admitted diagnosis is. It may also say what their historical disease would be. So if a patient has hypertension, that may be noted on there, but the reason for admit might be that they have pneumonia. Any kind of special procedures, if they're going to the GI lab, the endoscopy lab is another way to say that. If they're going to have an angioplasty and need to go to the cath lab, any specific types of treatments that they're going to have, if they're going to have radiation treatment, if they have specific directives or activities, patient must get up and walk around every 2 to 3 hours, okay to go to restroom by themselves or to the restroom with an assist, any kind of equipment or supplies that are needed, if they need an apparatus to check their breathing to make sure that their lungs are working properly, that may be ordered. Any tests, if we need CBC, Chem 7, a Procrit, any kind of clotting tests, if they need to have blood sugar tests, finger sticks. So there's a number of different types of information that are going to be found on a hospital order that aren't necessarily on an order for a community pharmacy medication. So also medical abbreviations, acronyms, and symbols. So we know, this is the information, this is the signa information, what's important. Generally, the RX symbol is not on a medication order in a hospital. route of administration, the dosing intervals, those types of things do need to be there because we might need to know specifically for the patient. Some items are going to be ordered PRN, which would be as needed. They may also have a frequency component to that, so they could have it every 4 hours as needed. Some specific directions for compounding, if there's a specific fluid that a physician wants a patient to have, their maintenance fluid may have additives such as potassium chloride, so the directive would have the amount of the potassium as well as the base fluid the physician would want in there. Generally, when we talk about some piggybacks, certain medications have what we call standard order sets. There's certain base solutions that they are compatible in. If the doctor wants to order an antibiotic IV, they don't usually tell us what base solution. They just tell us what drug they would like. We follow protocols to determine the base solution. In addition to knowing the abbreviations, there's certain shorthand pieces that physicians will use. An abbreviation like DC means discontinue. Symbols such as an up arrow or a down arrow can be used to indicate to increase or to decrease an amount. Also the the Greek symbol delta, which is a triangle symbol, that means change. So if they want us to increase the flow rate of their primary IV from 80 milliliters per hour to 100 milliliters per hour, they would write it with a arrow, and then let's see if I can get my pen working here. Or not. There we go. All right, so they might write it increase IV to 100 milliliters. That's not working very well. Let me try another pen. I have a stylist pen that I'm trying to work here. And I had a second one. There it is. Oops. Let's bring that back down to size. And try again with my... Okay. Anyways, increase to 100 milliliters per hour would be the symbol. Or if they want to change an antibiotic, they could write it with the delta symbol. All right. The interpretation, you're familiar with the interpretation. Specialized instructions, administering the medication, dose information, route of administration, how much is being dispensed. So those are very similar to what is used in a community pharmacy prescription order. The signal label will combine abbreviations, acronyms, and symbols. So transcribing or interpreting that requires you to understand the directive. So again, this is a review from 102. The medication orders are similar, but they're exclusive to the institutional or hospital setting. The medication orders are entered directly into a computer by the physician. That's generally known as CPOE, computerized physician order entry, which will come up on a slide in a minute or so. The orders, once they're in the system, become EMARs, or what are known as electronic medication administration records. So previously we had paper MARs. Those are documents that a nurse uses when they administer the medication, and it's a legal record. So they would notate on that record when the medication was given. So now, because most things are electronic, they go in and they do it in the patient profile, which creates an EMAR. Now, storage and retention of these prescriptions are legal documents. They have to be filed. The actual date the order was written must be provided, and those by law are kept up to 2 years or longer if indicated by the State Board of Pharmacy. Upon receipt of the medication order in the pharmacy, we no longer get hard copies of these orders, so generally it comes into the pharmacy through the computer system into what we call the queue, and that's spelled Q-U-E-U-E, I believe. And the pharmacist will go in and they will verify the information. We no longer transcribe generally those orders. That used to be a process called order entry, and with the computerization, that has changed. However, the pharmacist will still verify the information. Once it's verified, a label is then prepared for the medications.